Okay.
Hey everyone, it's Dr. Andrew Orr here. I thought I'd come on today and we have a chat about endometriosis or adenomyosis, and also we've got a special guest, Yoda. Um, so I thought one of the things that you probably all realise that my daughter Julia here has just gone in to have surgery for investigation for endometriosis and possible adeno. And one of the things we were discussing is that there's not a lot of information out there for people prior to surgery and what to do after surgery and some of the things that you need to do in general anyway. So I thought we'd talk about it more from Julia's perspective. Obviously, it's also a chance. A lot of people have basically come on our last post and posted well wishes to Julia as well. But it also highlights how many people are also suffering and probably going through the same thing or may not have even been diagnosed yet. So we'll start talking off about it. And obviously Julia's just had her surgery and recovering, and we'll talk about how she's recovered and what she's done and the expectations versus reality, which is a big one. All right, Julia, what would you like to say to women in general that might have period pain or suffering at home with pain, or may even already know that they've got endo?
Um, just go get investigated. I don't think it's worth spending your time, feeling all that pain and, being, bent over, feeling unwell all the time. It's just worth getting a look at it. Sometimes you've just, got to put yourself first and go for it. And it seems a bit daunting at first to maybe come to the terms with the fact that you've got something going on, but it's worth getting a look at so you can get it treated and managed properly. It's not worth being in pain.
Yeah, and that's one of the things we try and tell women, like what I tell women and what you tell our patients as well, is that period pain's not normal, and
Mm-mm.
we've got to stop women thinking that it is. A tiny bit of discomfort can be normal, but pain where you're dropping like lots of Panadol or lots of painkillers. So were you doing that towards the end of your surgery, leading up to your surgery?
Yeah, I just noticed myself having to take more painkillers and I felt a lot more discomfort. It was disrupting my day-to-day life and studying, and it just got to the point where I'd put off surgery for so long just because I was being stubborn about it. But I'm really glad that I got to go do it.
Yeah, I think that's the one thing that I see is that a lot of women sit at home thinking they've got to manage it on their own, and
Yeah.
they're not actively seeking help, and they think that is help, just popping painkillers. But what painkillers do while they help, they're just masking something. They're not really treating the problem. It's just fixing, symptomatic response. And if you're getting
Mm-hmm.
to a point that you're popping lots of painkillers, it means you need further investigation. Um,
Yeah.
so one of the things, what do you think we should tell? So one of the things we always talk about is seeing the right surgeon, because a lot of
Mm-hmm.
people don't know what a good surgeon is. And it should be what we call an advanced training laparoscopic surgeon, not just a normal general gynecologist or an obstetrician or someone like that. They need to have had the extra training, and they also need to specialize in diseases like adenomyosis, endometriosis, and have that extra surgical training. So how did you go about finding that? I suppose you're
Um,
lucky because you know who I know.
yeah, that's pretty much how I got to see who I saw. It's definitely worth seeking someone who has the extra training, because you don't want to put your health at risk of someone who doesn't really know what they're doing. I wouldn't trust someone who hadn't had the extra training with my body, or even my friends or family. I've heard too many horror stories from patients about how they have seen someone who isn't advanced trained and they've ended up being in more pain afterwards, and or they've completely misdiagnosed them or said they don't have endo when they do, and they don't know what to look for. It's not worth the time or the stress going to have surgery with someone that has no idea or a limited idea of what they're doing. Yeah, I just wouldn't take the gamble, and it is a gamble.
Yeah, it is a big gamble, and I think that's what people don't realise is that that could end up in multiple surgeries. And your first surgery should be your best surgery anyway, and it should be extensive and things like that. And we do see a lot of women that have had surgery with someone that is subpar. Yeah, and I was always taught at college is that anyone can do a laparoscopy, but doing one and doing one well is two totally different stories. And yeah, and it could end up multiple times. And that's what we see in the public system too. I think a lot of people don't realise that when you go into the public system, you're seeing a trainee. You're not, while they might have a lecturer or someone overseeing, that surgeon or lecturer does not do the surgery. It's a trainee, and they might get you back multiple times. Whereas if you see a good surgeon straight, it's one surgery. Sometimes if it's really extensive, like they might call in a bowel surgeon or something, like if you were riddled with it. And but that's, yeah, we're seeing the right person up front. So how was your experience? Like, we often see people who've had surgery previously with someone else and then see an advanced trained surgeon. You can tell the difference in their surgery and their recovery, things like that. What are the things what you would say to women leading up if you were about to go and get surgery? Say you've seen someone and you found an advanced trained surgeon. What about if someone didn't have that in their area? Would you recommend them? Like for me, I would say I would travel interstate if I had to. We're lucky here in Brisbane. We've got about 4 or 5 advanced trained surgeons here. Would you travel interstate?
Oh, absolutely. I'm on a student budget, so sometimes saving is hard for people, but I would absolutely, you know, put aside to go interstate if I didn't live in Brisbane, to see someone who's advanced trained and to see who I saw. I honestly, for the sake of your health, you're better off prioritizing, that, don't go spending a couple of $100 on your hair for a couple of months, or, put off getting your nails done and put that money aside to look after your health. It's so important to do that, because you don't want to be living in pain, and that's what I had to do, and I'm glad I did it. And I would absolutely recommend traveling interstate if you can. I would. It wouldn't matter where I was. I'd travel overseas if I had to. It's just worth getting proper care.
Yeah, and that's, I think, a lot of people don't understand too. And look, you just touched on it. Not everyone can afford to see a private specialist. But what I say to people is, look, if you can afford like $10, $15 a week and get private health insurance, even just basic hospital cover to cover you for gynecological services, it's worth it rather than waiting years in a public system. You could end up spending a lot of money on medications leading up to that, which could equate to surgery anyway. And these are the things we try and get people to look at. And then they end up accessing all these things online, supplements they don't need, all these, because as soon as someone hears online that you've got a disease state, oh, I can fix it. And then they'll tell you can buy all this stuff. So I know some patients come with a bag full of stuff, which, they had to save that money and spending on some of that rubbish. Not saying it's all rubbish, but most of it's rubbish, expensive pee. They could have probably saved that for a surgery, because it's not cheap. Surgery's not cheap. So... And it can, like you said, it can mean just saving money from getting your nails done, or maybe that piece of chocolate cake that you buy every day, or, like it adds up. Those little bits of money add up.
One less Uber Eats trip per week.
Yeah, and that's it. Like an Uber Eats trip, the net, like we spend money on things, but we've got to prioritize our health first.
Yeah.
What are the things that you would say to women leading up to surgery? What would you do to get ready for surgery?
Just have everything you need ready for when you're finished. So have your painkillers ready, have a heat pack ready, someone to look after you, make sure that's all organized. That way when you get home, it's all done and you can just rest. I know that I cleaned my house before I went in to make sure it was all ready and done, and just make sure, reach out to people if you need a support network. Definitely cash in on that. Just, family or friends, make sure you've got people there, because at the end of the day, you're going to need a little bit of help, whether that's just getting up out of bed or, someone going to the shops to grab you X, Y, or Z. What else? You got me some sanitary pads. I didn't even think about that sort of thing.
We'll talk about that post, because a lot of people don't realize when they wake up there might be dye and all these secretions that you never think about. But I think I tell patients is the healthier you can get prior to surgery, because we know that the healthier you are, the better you recover. So getting fit, things like that, making sure you've got good food. It's like preparing for a marathon. I always say that. So get yourself healthy. And then, looking after your mental health a bit, because it can be scary.
Yes, that's a big one. Just knowing different techniques to reduce anxiety while you're there, just because it can be a bit daunting.
Yeah, and we tell our patients downloading the Calm app, or download Headspace app, or some kind of relaxing app you can go through calming exercises each day to get there. And like I said, good food, preparing good food for afterwards, and not having junk food. As much as you probably will want to crave sweets and that, when you're repairing, you need good food to repair as well. What about post-surgery? What would you say to people post-surgery, what they're going to need? So you talked about the pads.
Yes, that's a big one. I didn't even think of. Thank goodness you got those for me, because with the Marina, I hadn't needed them for a little while. But yeah, thank goodness. Post-surgery, definitely a heat pack for your shoulders, because they pump your stomach full of gas and it puts pressure. I don't know the science behind it, actually. I have to research it, but it puts pressure on your shoulders and, your chest. Definitely have a heat pack for there.
I don't think a lot of people realize the shoulder tip pain.
Yeah.
Your
I think that's one of the bigger ones.
It is. It's probably more painful than the actual surgery. And your surgeon actually tries to push a lot of that gas out. He gives you a bit of a bear hug before you wake up. But yeah, it's just that any gas will rise to the highest point, and your highest point and highest cavity is in your shoulders. So it goes
it's a pressure gradient. Okay.
It's a pressure gradient, yeah. So gas can't escape, so it's got to rise and go to a cavity. So that's where the shoulder tip pain comes from. So what other things did you notice?
I had to take it easy. I'm a very go person. I don't like not being independent. So it was kind of hard to take a step back and let people do things for me, whether it was things just like getting out of bed or getting food. I had to, it was good I had my partner there to look after me and, get me the things I needed. And another thing is just taking it easy. It's sometimes hard to let go and let yourself relax. But I noticed even yesterday, I was talking to you about how I tried getting up, and it had been less than a week post-surgery, and I tried doing X, Y, and Z and doing all of this cleaning. And then I, felt really sore and out of breath. And I just remembered that, oh gosh, yeah, at the end of the day, I did have major surgery. I've got to take it easy for a little while. So don't rush back into, day-to-day life, and don't feel guilty about it either, because, sometimes you feel a bit guilty, having to depend on other people or not being able to do what you'd normally be able to do in your everyday life. But yeah, just take the time to rest, because it's important. We don't always get the opportunity to stop. So after surgery is definitely a good time to just stop and relax and not worry about things for a little bit. Just focus on yourself.
Yeah, well, a lot of people don't realise it in, not so long ago before laparoscopes, you would have had to have a big cut, big incision, and you would have seen that more. But now, because these incisions are only, 5 millimeters really, people think once they're healed up, they're healed, but it's not. It's 6 to 8 weeks internal healing, especially if they cut anything. And you're not going to be really up and fully mobile for about 2 weeks. I mean, you're up and mobile, like you.
Yeah, you can walk, but you're still sort of hunched over a little bit. You can only walk so far without going, okay, I need to sit down for a bit.
And you'll be bloated for probably a month from post-surgery, really.
Oh, yeah.
One of the things that a lot of women probably don't realise, we talked about the pads, is that if you do a laparoscopy, they usually do a hysteroscopy as well, which is meaning into a hysteroscopy is an evaluation into the cervix itself. And they usually will then do a dye study as well to look while they're there, they'll look at your tubes and they put this dye through. So you often wake up and going, oh my God, what's that blue stuff? And so you've got that blue dye still coming out.
Yeah.
Which is a bit scary.
Yeah, especially when you're disorientated at first waking up. You're like, oh my gosh, what happened to me? But yeah, the nurses usually explain everything, which is really nice.
And waking up can be hard for some people under anaesthetic. One of the things I always tell people is to get, fluids into you straight away. Not that I promote sugar, but it's probably one of the only times you should have something sugary to get your blood pressure up.
Absolutely.
Yeah, they get the blood sugars up. So use that. They won't normally let you go home until you've been to the toilet, move the bladder to make sure the bladder's working. And then they'll let you go home when you're fully coherent and not going to fall over and things like that. And then you've got to get home. So what did you do when you got home? What are one of the tips that you should have ready? Well, one, medication. You should be taking
pain medication
every 4 hours.
Absolutely. Don't be afraid of taking it at all. I was talking to a friend that had surgery at the same time as me, and she was worried about taking it. I said, no, you're in pain. definitely take what you need. It's not like you're going to be on it forever. It's worth it. Have that ready.
I think what people don't realise is that when you come out of anaesthetic, you've had a whole lot of narcotics to keep you under, really, and they're still acting in your body. So you've got this false sense of security around pain, but then when that drops out, the pain cascade can ramp up dramatically. So normally they give you some pain medication before you leave, but then you've got to keep up. So I usually tell people 24 to 48 hours, every 4 hours. The only problem you're going to have to watch, as you probably found out, is you can get a bit constipated from post-surgery and your medication too.
Yeah. So have your fibre ready.
Have your fibre ready. I tell people to use some Benny fibre. You can buy it at Coles or Woolworths. It's non-tasting. The only problem if you're gluten intolerant, it does have a little bit of wheat in it.
I just blended I know my partner blended a bunch of vegetables every day just in a blender, and I was just sipping on that, like celery, carrot, apples, just stuff with high fiber. It's chunky and it's not necessarily the nicest tasting thing, but it's so worth it.
I think people think they have to eat grains to get fibre, and it's not true. There's actually more fibre in apples, and keeping the skin on them, and veggies and greens.
Plants are full of fibre.
Yeah, full of fibre. Whereas when you eat flour and all that kind of stuff, it actually clogs you up. What other things did you? One of the things I promote is electrolytes. Yes. You got to keep hydrated.
Absolutely. Definitely dose up on the electrolytes, and stay hydrated. Drink water every minute you can.
Because it keeps your bowel moving too. It keeps your bowel hydrated. But your electrolyte balance goes out of balance when you have surgery, and also from anaesthetic. So they'll put fluid in you, but then you've got to go home. So you've got to keep that electrolyte balance up.
Make sure you get good electrolytes. The ones with magnesium added that I had, yeah, it was good too, because magnesium helps with your muscle pain and everything as well at the same time, which is good. Not Powerade, just avoid Powerade and Gatorade.
One thing I'll tell people right now, Powerade sports drinks are really just cordial. They're highly sugared cordial with a little bit of salt in it. They actually aren't electrolytes. So if you're overseas or somewhere and you had dysentery and you're dehydrated, they wouldn't hydrate you. And that's the reason people die around the world is not due to lack of water. It's actually due to lack of electrolytes. So you need proper electrolytes. Don't use those rubbish Gatorades, Powerades, whatever, those sports drinks. The other thing is you can feel a little bit nauseous probably from the pain. When you overdo it, your blood pressure can drop.
Yes.
So easy digested foods, we recommend warming foods, lots of soups, casseroles, broths. In your case, ramen.
I was very lucky. I ordered, I think the next day I ordered a bowl of ramen with konjac noodles instead of regular wheat noodles, and it's nice and warm. It was good. Yeah,
so brothy things where you can get lots of nutrients in. The smoothies and that are good, but they are a little bit cold on your tummy, so you got to watch that. Or have it at room temperature rather than having them in the fridge.
Definitely.
For easier digestion.
No added ice or anything, just blend up the veggies.
One of my lovely friends gave us some alkalized water, so making sure you have good filtered water as well, and lots of water.
Yeah, lots of water.
What else? Keeping warm? Keeping your tum?
Definitely. Just put some socks on your feet. I think I kept my compression stockings on actually from hospital for like a night or two, because I was laying flat, and it stops your blood clotting in your legs because you're not moving a lot. You're very sedentary for the first couple of days. I think people forget that you're laying horizontal, because when you get up you can feel a bit nauseous, or the pain comes back to your shoulders, because when you stand up the gas rises to the top. But definitely just make sure you're rugged up, covered with blankets, and that you're comfortable. Definitely I noticed that putting a pillow underneath my legs
elevate your legs.
Really helps. Just I had one pillow under my head, one pillow underneath, like where my knees are, and that really helped.
It's basic first step, but elevate and keep your compression stockings on, because the risk of DVTs and blood clotting and things like that is quite high. Anything else you'd recommend?
Mostly just taking it easy. I think as women, a lot of us are very we're very independent. We're ready to take on the world at any moment, but you've got to kind of put that aside for a little bit and just rest. The biggest thing is resting, and also having realistic expectations about how quickly you're going to recover from major surgery. They're little cuts, but your body doesn't repair itself overnight, which is something we drill into people quite heavily. Is it's not an overnight fix. You've just got to take it easy. Even a week post surgery, I thought, I can get up and do X, Y, and Z, but no, just take it easy. The world can wait for you. Right now, you've got to look after you.
Realistically, you're looking at, like, you could have it like you have it on Friday and go to work, but you would on Monday, but you'd be uncomfortable. Not saying you can't do it, but you'd be uncomfortable.
No, you can do it. You just got to still take it easy. Even if you do go back to work, like I went in a little bit, and, it was good to be able to just go, no, okay, this is my limit. I'm going to go home now. Or maybe I'll just take like a little bit of a break. Just like if you're going back to work, just explain your situation. Make sure that you're not afraid to speak up if you're not feeling unwell, and definitely go home if you need to. I'm sure that any good person would be understanding.
Yeah.
Yeah, just make sure that you've got like a good support network as well, and don't be afraid to ask for help if you need it, or if you need any clarification on how you're feeling. Don't be afraid to call your specialist or your surgeon's office to see what you should or shouldn't be doing. And book in a follow-up consultation. Always follow up what happened afterwards.
That's the one we see a lot, is a lot of people have the surgery and then there's no follow-up. A lot of them don't even know what happened, and don't have a management plan going forward either, because a lot of people think, oh, I've had the surgery, I'm cured, and there's
Nope.
there's no cure for endo. There's a cure for adeno, but that's a hysterectomy, and you're too young to have that. So
Yep.
You've got to manage it. So this is where your management then starts. You've had the surgery, you've got the medical management, so you've got a marina in. So you have to have progesterone to suppress any endometriotic implants or adeno from flares. And then you've got to look at all the other multimodality stuff, like, do you need help with your tummy, like your gut? So do you need to do work on your microbiome and all that, which is a good idea post-surgery anyway.
Yeah, wipes all your flora.
Yeah, so this is when we look at it medically now, that when you have surgery or you have medicines or stress or all bad food, it all wipes your good bacteria out.
Just learnt about it in food science. It's very real. I don't think people understand that the gut powers everything. It's how you get your energy. We know now that it affects your mental health, and it, when it's inflamed, it, exacerbates different symptoms and disease states. It's something that we need to take seriously, is gut health.
Gut health's a big one. Mental health is the other one, because you've got a disease that you're now going to have to live with. And it affects your hormones. It's not always just affects your hormone. Everyone blames hormones a lot, where really it's affecting more here. Pain, pelvic floor pain, you might need to see a pelvic floor physio. We've got a team of good pelvic floor physios we refer to. Doing pelvic floor specific exercises, dilators and stuff like that, if you've got pain through the pelvic floor. And working with those, so that get the pelvic floor hypertonus, where all the muscles turn on, and they getting the bowel to actually move, because some people's pain is actually their bowels clogged up. It's not this, it's their bowels are clogged up, or their bladder, they're not moving their bladder enough, and it's holding and storing in the bladder. So you might have to do that, go and have some acupuncture.
That's a big one. It really helps.
Yeah, it really helps with pain.
Really helps.
And it's all about reducing reliance on medication, because medication, as you know, you need it, but we don't want
it has its place.
It has its place, and we don't want you addicted. So if we can reduce your addiction to narcotics and medications and things like that, and use natural things to do it, then you use it.
Yeah.
And then if your pain ramps up, you save those medication for those big
your flares.
Your flares. The endobelly flares is the other bit. And be prepared to have those clothes ready for the fat days. Or what we call the bulleted days. Shouldn't say fat days.
I made sure I had some comfy tracksuit pants for after. Some high-waisted ones, because we can feel a bit self-conscious going into public, being a bit bloated. So some comfy high-waisted pants that don't put too much pressure on your belly are always good to have. They're just a staple everyone should have anyhow. It's comfy, but yeah, definitely helps for those days where you're a bit flared up.
And the exercise is an underrated thing as well. And so even though some days you don't feel like exercise, you're in pain, but exercise actually helps with pain.
Definitely. I notice that when I'm not exercising regularly, I have flare-ups that are worse. And sometimes, it can suck. You've got to listen to your body when, you need to rest, or if you're having a bad flare. But as soon as you're better again, just get back into that routine. It can be hard to jump back on that bandwagon, but it really does help. I think people really underestimate how good exercise is for, you know, just your overall well-being, but your mental health too. Because it all links together. All of it links together. So if you're looking after, you know, your mental health, your physical health, you can find a way to reduce your flare-ups and your symptoms. Yeah, definitely do it. Exercise certainly helps. Resistance work.
Yeah, resistance works really good. Or if you don't into weights or something, then something like Pilates Reformer, where you are still doing resistance, but you're working on the core and things like that. The mindfulness, but there's no shame, as I say to all women, if you've got a chronic disease, you should have a psychologist.
Absolutely.
And there's no shame in going, we have to get rid of this stigma that you're going to see the shrink and all that kind of stuff. Yeah, it should be part of your normal life, is checking in your mental health.
I think everybody should be looking after their mental health and treating it just as importantly as physical health. I think, you know, not just people with chronic illnesses, but everyone should be seeing a psychologist if they can and they have access to that. Just whether it's monthly or every month or two, or even if you need to do it, you know, a couple of weeks where you do it weekly or fortnightly, just to get on top of yourself. It really helps just to have someone to talk to, even just to figure out ways, management strategies. So if you're feeling a little bit anxious, or if you're going through a flare up and you know, we tend to freak out and feel really bad about ourselves during those moments. So it's good to have techniques you can use in everyday life just to, you know, keep on top of everything. It's so important. And yeah, if people, I think people under the age of 25 can go to Headspace. I'm not sure of services that are bulk billable past that. I know there's a few in Brisbane, but I'd have to look into it more. But yeah, it's so worth it for everyone.
When people don't realise they can now access, at any age, they can access a mental health plan, which is subsidised plans. There are free counselling services around. There's also the pain management plan that you can access to, the Allied Healthcare Pain Management plan.
Awesome.
So you can access physios, allied healthcare professionals, and have pain plan done. So when people say, oh, I can't afford it, as you know, you're a student.
Yep.
There's always ways of affording. So you don't pay for Headspace. You don't pay for Headspace.
Nope.
Yeah. Those apps are pretty good, like you were saying.
Yeah.
Even some of the apps for food apps, like we often give our patients, like Paleo Plate, because not just promoting paleo lifestyle, it's more that they have really good recipes and it's easy to prepare. And
yeah, I think one of the biggest questions we get is, oh, well, you know, all of a sudden you're asking these people to, a lot of the modern Western diet is a lot of carbohydrate heavy foods full of grains. You know, you walk through the shopping centers and all you see is just packaged food. So everyone's so used to, you know, those instant meals, you know, things that are quick, easy, that fill you up rather than provide you with nutrition. So yeah, the biggest questions we get are around, oh, well, what do I eat? Recipes. And a lot of it is you can make the same sorts of dishes you usually do. You're just substituting ingredients, essentially. So yeah, apps like Paleo Plate or even Google, we've got the whole internet at our fingertips. There's some awesome recipes online to get inspiration from. There's things on YouTube now where you can watch them cook and you can follow the recipe as you go. For people that learn better through, you know, watching visuals. And yeah, but Paleo Plate's a good one. I really like it.
Yeah, and it's just about low inflammatory based food. So basically if it comes from the ground or a tree and it's not out of a packet, that's pretty much low inflammatory.
Yeah,
food.
the outer aisles, usually the fresh fruit and veg aisles and, you know, that sort of thing. Your whole foods are the best place to shop. Avoid the inner aisles where everything's packaged and, you know, not so great for you.
That's right. And then, you know, every so often saying we talk about a freedom meal once a week.
Yeah.
Freedom meal, not a freedom day, but a freedom meal. Because when you eat those bad foods, it adds to flares as well. Alcohol.
Absolutely.
Also. So it all adds up.
Yes, it does add up. I know that if I eat poorly, or if I, have a few drinks with friends, I notice that I'm just not well. It really does make an impact. And I think a big thing with that too is listening to your body. A lot of people aren't in tune with how they're feeling, or how things react inside their body. I think if we all pay attention to that and go, how am I really feeling after eating that whole block of chocolate? It's not that you can't have little bits here and there, because I think it's okay to have little bits. It's just about having things in moderation. And even with freedom meals, like for example, and in terms of ramen, like it's not, I guess, the healthiest meal in the world, but instead of noodles, I'll ask to add veggies, or if I feel like noodles, I'll get those seaweed based noodles instead of the whole wheat noodles, which I know definitely make me feel like trash. It's just about substituting things. It's not about totally eliminating, those foods that we all love from our diets. It's just about, finding alternatives.
Yeah, I think if you can get rid of wheat, I think most people flare with gluten. And it's just they might have one thing, then they might have another and be right, and then they have the third thing and then tip. And so it's just these gradual build-ups. The binging, the alcohol binging does it. It's not saying you can't have a glass of wine, but if you have a binge night, you're going to feel it.
Yeah, you do.
It's poison. It is poison.
Oh, yeah, our body's not meant to have it. We don't have alcohol receptors, but one or two, I think two, anything in excess of two, I believe, is binging, which I think not a lot of people realize.
Yeah. And we see often people go out on a night on the town and they'll have shots and things like that, but you ask them to take some medicines that might help them, which taste just as disgusting as it's just as disgusting as a tequila shot, really. But
if you can have a tequila shot, you can have your herbal medicines, and you do get used to it too. I remember really putting up a fuss when I had herbs as a kid, but now I love them. It's just like having a herbal tea, and once you understand what it's doing to your body and that it's good for you, you kind of appreciate it a little bit more. And it doesn't become so icky after that. But yeah, definitely, if you can do a shot of tequila, you can suck it up.
And it's about seeing, again, qualified professionals. Don't self-administer things. So while herbal medicines and that can be used alongside Western medicine and should be part of a multimodality approach, always see a qualified healthcare professional. Don't buy things offline without a consultation. Because you can make yourself sick. Like you can actually make and damage yourself. Like your liver's got to process all those things.
And certain ingredients contraindicate other medications that you might be on. You really need to talk to a practitioner about, how does this herbal medicine I'm taking interact with this? And that's why it's important to see someone, because they will know the answer to that, and they'll be able to give you things that don't completely discount all the other stuff you're doing. Just because it's natural doesn't mean that it won't contraindicate something else that you're taking.
And if you can't find someone. The value of a second opinion is really, really important. That goes from medical and complementary medicine. So, and talking with your GP, find a good GP that will listen to you as well. And if they don't, find another one.
Don't be afraid to shop for GPs to find one that will listen to you and take you seriously. I think that's something a lot of people struggle with, is finding someone that will actually just take the time and listen, and that shows that they care, rather than just trying to get you in and out in 10-15 minutes. It sits you down and goes, okay, no, we're going to do something to help you, and takes you seriously.
Even if that GP just writes your referral to a specialist, that is their job done, because that's what I tell people. It's not putting GPs down, and GPs aren't gynecologists. They're just general practitioners. So what they should do is listen and go, that's a gynecological issue. They need to see a gynecologist. And you might be able to point them and say, hey, look, I've found this advanced trained surgeon. I've heard really good things, blah, blah, blah. Can you write me a referral to this? Because often they don't know who they're referring to either. They don't know their skills. But women are missed for up to 10 years or more with endometriosis, and that's a fact. So this is where it all starts.
Yeah.
non-referrals.
Mm.
But it can also not just be GPs. It can be people thinking that their symptoms are normal and not seeking help for 10 years either.
Yes, that's a big one I see with even just going through high school and even uni, talking to friends, you know, talking about period pain like it's just a normal thing that we have to go through, and they'll have their heat packs ready. And I go, why don't you go get that checked out? If you're in pain, something's not right. And they all go, oh, but everyone gets it. And I go, it's not normal. I think there's a misconception that we have to tolerate pain and we've got to be strong, you know, and, you know, as women, we are strong. It's not to discredit that, but sometimes you got to be vulnerable and go, actually, no, hold on a minute. Like, I'm not okay. I need help. I can't do this myself. And that's so important, is to understand, you know, that limit. As you said, a little bit of discomfort can be normal, but even then it's best to check it out, because sometimes you can be asymptomatic as well. You can, you got no symptoms and you go to try and conceive, or, you know, something doesn't seem right down the track, and you go, and somebody goes, oh, here we go, you might have endo or adenomyosis, or yeah.
Yeah, and I know a lot. We always say that early intervention is the key, and I know some of my patients that I've seen since they were 14, you know, and they've been investigated, put down to now being investigated early is the reason why they've been able to have children, and haven't had any major issues because they've been managed from a very young age. Whereas the women that leave it, and then it's really hard to treat a disease the longer you've left it. I say it's like rust, and I've got a blog about, rust never sleeps and neither does endo. The longer you leave rust, the worse it spreads, and that's endometriosis. The worse it spreads, it can do so much damage. It can do permanent damage, and you can't fix it. So this is why, and it could cause you not to be able to have children. So the longer you leave it, so mums out there, if you've got daughters with period pain, get onto it early. Get onto it early.
I think one of the scariest things is hearing stories, or even just mums going, oh, I'm so sick of it, hearing them complain all the time. They just need to suck it up. And I go, oh my goodness, no. You need to go get that looked into, because whilst it might not be your health and your body, like, that's your kid and that's their health. And a lot of them end up, I think, when you mentioned the prospect of them may not, you know, not being able to have children in future, that's when they all freak out and go, oh yeah, I got to get my child fixed. But the moment they are in pain, like, you have a duty of care to go and look into that. It's not worth having your kid lying on the floor crying, you know, every night. Oh man, yeah, go get that looked at. I understand that it's not you, and that, you know, you might be able to withstand a certain amount of pain, but what they're feeling, yeah, I can't even describe it. It hurts. Definitely look into it. To all mothers out there, take it seriously.
That's exactly right. And that's what some of the ways I get mothers to listen is just say, well, do you want to be a grandparent?
Yeah, and it's sad that it takes that, but, you know, maybe, yeah.
Or do you want to see your daughter's bowel perforated? Because that's that can happen with endometriosis. They can get impacted bowels, compacted. And yeah, that's the extreme of it. But the emotional state of it is we see women committing suicide because they're not taken seriously with their mental health, which then exacerbates their pain pathways, and then their pain becomes worse, their mental health becomes worse, and then the whole lot meets, and then no one's listening and overdose, or, you know, or worse, you know. So
yeah,
we've got to start listening more. And so early intervention is the key for any disease. So we can't prevent endometriosis because it is genetic and so forth, like that. But yeah, we can certainly be aware that if it's in families that your daughters do get pain, then you know you've got it, then there's a good chance she's got it. There's more than a big chance you've got it. Any other things you'd recommend at this stage?
Not really. Just put yourself first. Honestly, it's worth just taking that time to go, you know what, everything else can wait. I'm important too, because at the end of the day, you need to be able to make the decision to look after yourself, because there's only one you at the end of the day. And it's important to preserve that and make sure you've got a management plan moving forwards as well. I think the biggest thing, as you were saying, people forget is, I think once surgery's done, or once they've had one treatment or one lot of herbs, everything's all cured and it's magical. When science and the human body doesn't work like that. It's like if you broke your leg, it's not going to be fixed overnight. That's months of rehabilitation. And the same goes for reproductive disorders or even gut health problems. It is not overnight. It can be months or years of consistent, and I highlight the word consistent because it is consistent work. You can't do 2 weeks of eating well and then a couple of months of not eating well, because the body doesn't work like that. It's not easy. I'm not going to say, try and make up this, fantasy idea that it's going to be all easy and cruisy. You've got to work, but it's worth it in the long run, because if you can, find what works for you and stick to that and just get into a routine, then it makes it so much easier. And once you've done it for a couple of weeks, a month, I think it takes to build good habits and really stick to them. It gets so much easier, and just stick to it. It can seem daunting and time consuming, but it is so worth it.
It takes around 21 days to form a habit. And with any gynecological disorder or disease, you're going to have this for life, especially things like endometriosis, even past menopause. You just got to learn to manage it, just like a diabetic has to learn to manage their health. Asthmatics, they're not going to get rid of that. So it's all about management, and it's a lifestyle. You have to work around a lifestyle so that you can have a normal life.
Yes.
If you manage it properly, you have a normal life.
Yep.
If you don't manage it, you have flares and you don't have a normal life, and your life sucks for a long time until you realize, if I manage this better and I get better management, I can have a normal life.
Yep.
So see the right people.
Definitely.
All right. Well, thanks for coming on today and explaining that to people, just so that they know and they can hear more about how you went, and because everyone wanted to know. I even put up a story that I'm closed for the week and everyone's going, Julia. All right.
That's
well,
really
thanks.
Nice.
Yeah. So thanks very much for explaining that, and hope this helps a lot of people, and they get to hear your story and your side of it as well.
Yeah, and don't be afraid to, if you want to send me an email and ask me some questions from work, just go for it. That's what I'm here for, because at the end of the day, I'm going through a lot of the same things a lot of you are, and it's important to be able to talk to people about that.
Yeah, and if you're finding it hard to access services and that, you can book in a consult with me. We can help you on that. Even if you're at a distance or live overseas or whatever, you can still have a consult, and we can try and direct you and help you the best we can, and act like a guide and an advocate for you. Even though we can't physically help you on that, front, but we can also, part of what we're doing is getting a worldwide network of people. Like we work with our close group of network here in Australia. We want to replicate that everywhere, so we can help you and help and guide you, and step by step hold your hand. You need to do this, you need to do that. And even that in itself is a help. So, yeah.
Awesome.
All right, everyone. Thanks very much for listening. Thanks, Julia. And we'll bring you some more information soon.
Awesome. Thanks, Dad.
No worries. Bye.
Bye.